Hello everyone, and welcome to the webinar Harmonization of Contributory and Non-Contributory Programs. This is the second webinar in the series Fiscal Space for Social Protection. This knowledge sharing initiative is hosted by the socialprotection.org platform, so I would like to invite everyone here to join the platform and follow us on Facebook and Twitter. In the platform you will find the Fiscal Space for Social Protection Knowledge Sharing Initiative online community where you can be up to date in the news from this webinar series. This knowledge sharing initiative is a partnership between HelpAge International and the International Policy Center for Inclusive Growth. My name is Raquel Tebaldi and I'll be the moderator for today's webinar. I am a research assistant at IPC-IG and I work for the socialprotection.org platform. Our panel today is composed of Stephen Kidd, who is the Senior Social Policy Specialist at Development Pathways and has more than 30 years experience working on social security and social development. He was previously Director of Policy at HelpAge International and a Senior Social Development Advisor at DFID, where he led the social protection and equity and rights policy teams. He has published extensively on social security, including on issues such as targeting, conditions, pension systems, child vulnerability, disability, and the political economy of social protection. Our discussant today is Rebecca Holmes. She is a research fellow in the social protection program at ODI, the Overseas Development Institute, and she specializes in social protection, gender, and livelihoods. She has also recently worked on women's economic empowerment, voice, and leadership research projects. She has published widely for a range of audiences on social protection, gender, and women's empowerment, including a co-authored book with Nicola Jones entitled Gender and Social Protection in the Developing World, Beyond Mothers and Safety Nets. Before we go to the first presentation today, I would just like to remind everyone that you can send the questions throughout the webinar via the chat bar and also in our social media using the hashtag #FPOrgWebinar. So now I will give the word to Stephen.
Okay, thank you very much, and good morning, afternoon, and evening to everybody. We have the topic of contributory and non-contributory social security. And this is a very, very broad topic, and we've only got 20 minutes to talk about this, so I'll do my best to bring it down into that period. I'd also like to say, I think, that to start off with, I'll be mainly talking about what I'm going to refer to as social security, which really is the sort of income transfers element of social protection. We don't have time to get into broader aspects such as health financing, etc. Now, if we go to the next slide, what I wanted to start with is to get us thinking about who are we talking about when we're talking about contributory, non-contributory social protection, because we often talk about, you know, the poor, a simple dichotomy of the poor and the non-poor, and we're going to give social protection to the poor and contributory schemes go to the rich. This is kind of a very simple thinking that we have. I think what I want to try and stress here is that actually, while poverty is real, the concept of the poor is very much a fictional construct. While poverty rates are great for measuring progress in the country, they're not great for social policy. So if a country says it has a poverty rate of 37%, for example, it doesn't mean that 37% of the population are poor. Many more people are poor and living in poverty. So this slide just shows different economic classes, should we say, in a number of countries, and just showing that, you know, in some countries like Rwanda, we even have you know, people living in $1.25 is over 60% of the population. But those who are really poor, under $4 a day or even under $2 a day, are still 95% of the population. And even a country like Indonesia, middle income country, we still have around 80% of the population living under $4 a day. And anybody living on $4 a day, and this is in purchasing power parity terms, really is in need of some form of social protection. If we go to the next slide, it's just showing a similar pattern, but this is from World Bank data, just looking across a whole range of countries. I don't have time to go into detail, but what is actually shown for each of the countries here, the majority of the population could be classified as poor, moderately poor, insecure. And so the vast proportion of people that we're talking about in developing countries actually have very, very little to live on. But there is no such thing as a fixed group of the poor. People respond because of shocks and other crises that they face, or by taking opportunities. People's consumption income can change dramatically year by year. So we go to the next slide. This shows an example of wealth rankings in Indonesia, and the changes over 1 year. So if we look at the left-hand side, we've ranked everybody there from poorest to richest, 20% in each quintile, and where they were on the left-hand side from each color, the poorest being in orange, the yellow, the next poorest group in 2009. And then we're looking at where they were in 2010, and we see a vast change already in just 1 year. A lot of people have moved up, a lot of people have moved down. And so even amongst the poorest group, we have around 40% being replaced by people who've dropped down, not just from people just above say the poverty line, but actually including people from the very richest group who may have dropped down for some shock, maybe because of a disability, or even having a child or losing a job. So we're talking here about a highly dynamic situation in which we have to provide social protection. So I want us to bear this in mind as we get into the talk around contributory and non-contributory social protection. And if we have any questions on this, we can get back to it later. So the next slide, I think, is to gives a very simple classification of social security schemes. And I think we're often, taught to think around, contributory and non-contributory, or we're talked about social assistance and social insurance programs. I'm using a different classification here for particular purposes. And I'm trying to divide very simplistically social security schemes into two types. One that's financed by from general government finances, or called here tax finance, and the other which are contributory schemes. Now, tax finance schemes, I think it's important to distinguish between two very different types of tax finance scheme. One is schemes that are entitlements, which everybody has the right to. Everybody who has the right to social security can enjoy. Right to social security, we'll find international conventions in the constitutions of many countries, such as Indonesia, Kenya, Bangladesh, etc. And these are, as I say, programs for everybody that they can access whenever they need them. And so a good example might be a universal social pension. You could have means-tested programs that function well, and which could also be entitlement programs, because you get it when you actually fall below the eligibility line. And these are distinguished from social assistance schemes, which are really schemes just for the poor, which are targeted at the poor. An example of a pension system would be a targeted social pension, which perhaps we target at 20% of the oldest. Then amongst contributory schemes, we have two very different types. One is a social insurance scheme, generally managed and overseen by government, which is based on a solidarity principle, so you contribute to it through your working life. And there's some kind of solidarity in that those who contribute more receive less, for example, in their pension when they have a disability, or unemployment, or an old age pension. And those who perhaps contributed less but are still members of the schemes get a bit more, because there's some sharing within the system. And this is different from private contributory schemes, where basically you get out what you put in, and it's linked, there's essentially savings schemes and investments. And this could be an employment-based pension, for example, that your employer provides, and is often the amount you get is just based on the level of contributions that you have. So this is a very simple classification of schemes that we're going to be using. If we look at the next slide, we can see the different aims of the different components of a social security system. The tax financed social protection is essentially about providing individuals and families with a minimum income, a minimum guaranteed income that they know they won't fall before. This is the floor that we're putting in place, very much linked to the concept of the social protection floor, and as I'll show, can only be achieved through really entitlement programs effectively. And then the other, from contributory schemes, the effective aim of those is to enable working age people to undertake consumption smoothing across their lives, so they save at some point, and then when they experience a shock, which could include retirement, then they're able to draw on those and have higher incomes at the point at which they experience a shock and need to access the social protection system. And as we'll see, the two can work together very well. And both types of scheme offer insurance against the risks that you face during your life. So disability, if the risk of disability that we all face, could be addressed either by a tax finance disability pension or could be addressed by a social insurance scheme. And people could potentially ask both. But it's a kind of insurance against that risk that we have. And these are very simply the three aims that we get from different types of schemes. So if we move to the next slide, I think this is just quickly to point out that I think we need to be very careful when we talk about non-contributory schemes, because we often think of them that these are just things given by the government and that we've not done anything to achieve them, we've not contributed in any form, which I think is a very wrong way of actually thinking about these schemes. We really need to think about contributory schemes are actually contributory schemes, or non-contributory schemes, tax finance schemes are actually contributory to a large extent, because citizens on the left-hand side contribute to the nation in many ways. They bring up their children, they work, they pay taxes, direct or indirect taxes. Those taxes go to the government, and the government then gives them back as social security entitlements to citizens. So there's actually tax finance schemes or programs provided by citizens to citizens, mediated by government, and therefore calling them non-contributory actually disassociates themselves from their real source, which is financed by the work of citizens. So whenever we access a non-contributory scheme, we're actually doing it on the basis that we've made a contribution and it's our entitlement. Well, that's the basis that it should be if we have a rights-based approach to it. And all of this is a way of building the social contract. Generate more taxes by people then receiving, will receive benefits, and by receiving benefits they'll be more willing to pay more taxes, and we build a social contract within a country. If we go to the next slide, we'll look at some of the challenges of just providing social protection through a contributory system. Because as we see, and I'll show a little bit later in terms of access, contributory schemes are great for those that are in the formal economy, although often in countries we find that people in the formal economy still don't access them. But for those in the informal economy, it's much more difficult for them to access. Why is that? It's often because people have incomes are just too low. As we've seen, 70–80% of many developing countries, people's incomes are too low to regularly contribute, so they're unable to save. Incomes are irregular, which means that they can't save on a regular basis, which is important to do. There's often no counterpart if you're in the informal economy, such as your employer, who will also put in place an additional contribution. So you're just based on your own contributions, whereas social insurance, as we'll see, is really based about contributions from the employer and the employee together, which increase the value of the employee's contributions. It's also often very difficult to make payments in many places. There just isn't enough outlets for you to make a payment if you're living in rural areas. And of course, many people are just not in employment, such as women caring for children. Some people with very severe disabilities may not be in employment, and they just can't contribute. So a contributory scheme won't work for them. And it's also important to bear in mind that contributions are a form of taxation on the workforce, and this level of taxation can be very, very high and puts people off. So if we go to the next slide, we can see the average sort of levels of contributions that we find across different continents. The amount, that percentage of salaries that are paid by employees and the percentage that are paid by the employer. And we can see that in some places we're talking about an additional 20% of income that is paid. And this is a big disincentive, these high levels of income for the formalization of the workforce. That's why we find many employers preferring to stay in the informal economy, because they can avoid these kind of levels of taxes. In some countries, these are just averages. We get much higher levels of tax, which are a big disincentive for people. So that puts employers off entering into contributory schemes. So the next slide shows the coverage of, looking here at old age pension scheme, or pension and disability and old age pension schemes around the world from ILO data from 2010-11. It's just look at the percentage of active contributors into these schemes to see how effective they are in covering the population. And we find that it's only a few developed countries, Europe, North America, Australasia, that have above 75% coverage. And in many countries, particularly across Africa and Asia, we find coverage at less than 25% of the population. So contributory pensions, while they could be are good for a certain group to give them consumption smoothing, are really not reaching the vast majority of the population. So we go to the next slide. And contributory schemes also tend in all countries to incorporate a strong gender bias, often because there's less women in the formal economy labor force, and also because women take time out of the formal economy, and therefore their salaries might be lower, they may make less contributions, and therefore their pensions, when they get them, are going to be lower. Less women in the system and lower pensions overall. You could look at this slide in more detail later if you wish at the coverage of pension schemes across different continents between men and women. So they have a strong bias contributions women. So we go to the next slide. And I think when we're trying to build an approach, if you know, one of the big challenges where we have a big push in many, many countries is this kind of acceptance that we need to target the poor, this fictional group called the poor, which we've got to remember people are moving up and down all the time in terms of their consumption and income, moving up and down below and above poverty lines. The big challenge that we have when we have systems that target the poor, which are combined with social insurance systems, we have a situation like this example from Indonesia, where we've divided into different classes of the population, those in extreme poverty, and insecurity, which is the majority of the population. And we find that social insurance is being put in place effectively aimed at the formal sector and by design assumed to be those who are better off, the middle class and those just below. And we have social assistance schemes which are targeted at the very poor, still with very high errors in terms of the targeting that we find, as we find in any country. We have high errors of targeting. At least 50% of those targeted will be missing out. But we have a big group in the missing middle. This group, which I showed earlier, are still living in poverty, are still highly insecure, still need protection, are being missed. And we don't have an effective system that covers everybody as an entitlement by having this model of targeting the poor and providing social insurance, which is the most common model that is often promoted in developing countries. Now, to look at this in more detail, we can look at then options for pension systems and how we might overcome this challenge. So we go into the next slide. We see the first option for developing pension systems. I should explain in this, we're looking at from the left to the right, we're looking at the poorest older people to the richest older people, and the different color blocks are showing different types of pension. The orange is the tax finance pension, the blue is your mandatory social insurance pension, and your green is your private or voluntary pension. So we have three tiers, basic tiers of pension systems. Now, when we target the poor with the tax finance pension, with a means tested pension, as you'll see here, we tend to end up with very large coverage gaps, depending to the extent to which people are in the social insurance system and how many are being targeted by the program for the poor. So often coverage gaps might be very, very large. Some they're a bit smaller. But what we do have in this kind of system is when we have a coverage gap, so many older people in the middle are missing out. So a very high proportion of those in the informal economy are missing out in an old age pension. But we're also creating perverse incentives because we're discouraging people from contributing to the social insurance scheme because they know that if they contribute to the social insurance scheme, they'll miss out on the poverty targeted scheme once they reach the age of eligibility. So they're going to be put off contributing into the social insurance scheme because it seems a waste of money. Or they may just withdraw their contributions as a lump sum before they retire so that they can throw themselves into poverty and then access the poverty targeted pension. We've seen these perverse incentives. Australia has fought for many years against this by having a poverty targeted pension on a slightly different design, a higher coverage of their poverty targeted. But it's a big problem, and we're creating these disincentives. So the poverty targeted pension is undermining the social insurance scheme. Chile's pension system is an interesting example of this. After the 1980s reform in Chile on their social insurance scheme, they believe they've made the mandatory scheme, got behind that, and they put in place a poverty targeted pension. And what they found over 30 years is that actually the formal economy shrank because of probably because of the high levels of contribution, but also because of the perverse incentives that they put in place. It wasn't worth people getting in the social insurance scheme when they could prefer to get the program that was targeted for the poor. So they undermined the contributory system in that way, and in around 2008, 2009, they made significant reforms to bring in place a different type of pension system, which is a more effective systems approach, which was a pension-tested system. So if we go to the next diagram, the next slide, we see two options of the type of approach to where we link tax-financed and contributory schemes through pension testing in this example. The top one is through very simple pension testing, which we find in lots of countries. Thailand, Lesotho, etc., Nepal have this kind of very simple and quite brutal pension testing, in that if you have a contributory scheme, then you do not get the tax finance scheme. And so everybody that we have 100% universal coverage, but we still have the perverse incentives in place, because why would you contribute if that means you're going to miss out on the tax finance scheme when you're older? So the other form of pension testing is in the bottom diagram, and this is the type that Chile introduced, where you taper down the amount you receive from the tax finance scheme related to how much you have in the mandatory in the social insurance scheme. So for every dollar perhaps that you, in Chile it would be the equivalent, for every dollar that you get in the social insurance, for every $3 you get in the social insurance scheme, you lose $1 from the tax finance system. And the hope is that through that tapering, we reduce the perverse incentive to actually not go into the contributory scheme. We're going to the next slide, is the simplest form of building a comprehensive pension system, linking the two together, which we find in a range of countries also, is really just a simple universal citizens pension that everybody gets across the bottom, and we build a contributory scheme on top of that so that those who wish to have more in old age can contribute, and we create no perverse incentives in this because nobody loses out at all. You always get more for the contributory system, and this is going to be the most effective system in terms of encouraging people to get into the contributory system. New Zealand is an interesting case in this, in that they actually don't have a mandatory social insurance scheme. They only have voluntary pensions in New Zealand. But what they do in New Zealand is they provide a universal pension for everybody, but they continue to tax you in old age on terms of your income. So they claw some of the pension, the state pension that they give you, back through the tax system, but they don't create the perverse incentives because everybody still gets it. You just get a clawback in tax if you have a much higher contributory pension in New Zealand, and around half the population there have voluntary contributory schemes. So the next slide is just a brief chart from the ILO showing the types of different systems of pension schemes that we find across the world. The interesting thing out there is we can see there's actually around 36 countries that either have universal tax finance schemes only or contributory schemes as well as universal schemes, and around 50, you put my glasses on, 53 countries that have a mix of the zero pillar option, where it's poverty targeted and contributory, which is going to undermine the contributory scheme, and 77 countries that are only providing contributory schemes, which is meaning that a high proportion of people living in poverty or the informal economy are still not able to access a pension system. So just getting near the end, I think the next slide is just showing, is not to think that, providing tax finance schemes that are universal high coverage is unusual in developing countries. This is the list of countries and how much they're actually investing in tax finance pensions. Those in orange are above two-thirds coverage. Those in blue are below two-thirds coverage. And we can see that many countries, developing countries, are already investing more than 1% of GDP, guaranteeing everybody in the informal economy a pension. And on top of that, other people can also get the social insurance pensions as well. And exceptional country like Georgia is already spending more than 4% of GDP in providing high quality pensions to everybody in the informal economy, as well as those who weren't able to work throughout their lives. But those who are targeting the pensions are providing much less, and actually if you were to, there's a paper I wrote on the political economy of targeting, are actually generally providing much lower value transfers because these schemes aren't so popular. So the most effective schemes of building the system are more universal schemes, or at least tapered pension tested schemes that reduce the incentives, give higher investment from tax, more effective schemes, better lives to older people or people with disabilities or others who are accessing schemes, and provide higher benefits than you get with poverty targeted schemes. So finally, get to the last couple of slides, because the next one, I think it's just a reminder, we often think that those receiving social insurance are well off. And I already alluded to that earlier in terms of my ideal model from Indonesia. This is just data from Vietnam, looking at recipients of social insurance schemes in Vietnam across the consumption deciles, from the poorest decile, which is decile 1 of the population, to the richest decile 10. And looking at the percentage of older people in each decile who are receiving the social insurance pensions in Vietnam. Looking at the pre-transfer value at the left, we see that a high proportion of people without these pensions will be living in absolute poverty. Some are in around middle incomes, but still high levels of insecurity. And even without the pension, the social insurance pension would be well off. The right-hand side, we look at the post-transfer situation, and we find that while a lot of people now with their pensions, some of which are quite high, are in the richest deciles of the population, it's also interesting that even with the social insurance pension, some older people in their households are still living in absolute utter poverty in the lowest deciles. So let's not be fooled into thinking that while social insurance schemes may be a good thing, many people still access or receive very little from them. So the final, in terms of the takeaways from this session, is that I think tax finance social security schemes, particularly when they're provided as entitlements rather than social assistance schemes, are an absolutely essential means of ensuring that everyone is guaranteed some form of minimum income, which is what we really want to achieve through a social protection system. But as part of the same system, countries can also build on top of that contributory schemes that enable people to save and receive higher benefits whenever they're affected by a shock. And both tax and contributory finance schemes are appropriate for developing countries. Virtually all developing countries could put in place well-designed schemes that could begin to provide universal coverage in most developing countries, particularly for older pensions and disability benefits. But it's only through, finally, it's only through tax finance schemes that it's possible to guarantee access to social protection for those in the informal economy. While some people in the formal economy can get into contributor schemes, it's never going to be a very large proportion of the population, and the majority need to receive some form of tax finance system. So I'll just finish there.
Thank you very much, Stephen. Thank you for this great presentation. And now we move to Rebecca's presentation. Rebecca, over to you.
Great, thank you very much. Sorry that I can't get my webcam to work at the moment. And do you have the presentation up there as well? Great, thank you. Thanks very much, Stephen, for that interesting presentation. And I'm going to build on and just draw on a few of the things which Stephen has just been talking about, especially in terms of the focus on experiences of extending social insurance schemes and looking at the challenges to that. As Stephen just said, there are huge challenges to reaching the informal workers through social insurance schemes, so through contributory schemes. So I'm just going to reflect a bit on, what are the kind of experiences of where social insurance has been extended, and then what are the challenges, just going into a bit of detail around some of the specific challenges that women in particular face, so the gender-related challenges, specifically of informal workers. I think it's also important to note that social insurance is an important instrument, and especially given, you know, in some countries limited coverage of social assistance as well, and this need for you know, a two-pronged approach or even more, a package of social protection instruments within a social security or social protection system. And I think this is especially important given that in so many countries the informal workforce represent or make up the majority of the working age population. So you're looking at extending coverage potentially to a huge, on a huge scale. So just briefly, some of the countries that have been extending social insurance schemes over the last few years, over the last decade or so. Brazil and South Africa, for example, have extended social insurance schemes to informal workers, and particularly domestic workers, so those previously excluded from being allowed to contribute to social insurance schemes. And in South Africa this has been unemployment insurance, and in Brazil this is, and South Africa, maternity provisions too. China has also seen a rapid expansion of various social insurance schemes, both work-related but also health insurance schemes as well. And some quite known more health insurance schemes from Ghana and from Rwanda, you know, reaching sort of 60–90% of the population through health insurance schemes. If I could go to the next slide, please. Despite, you know, some good examples, some good progress overall of some countries expanding social insurance, I think a closer look at what this actually means in practice reveals a more unequal picture. And here I just wanted to pick up three main points, particularly looking from a gender perspective. So one is around the gender gaps in coverage. And as Stephen mentioned in his presentation as well, the fact that women are less likely to be covered by social pensions, for example. This holds true across social insurance. Another challenge is around low coverage of certain types of risks, which both women and men face, but might be intensified by particular risks that women face. And then unequal benefits from schemes, even if both men and women are participating in a scheme. So just going into a bit more detail on each of these. In terms of the gender gaps in coverage, I mean, this is really due to two issues. One is around eligibility, but the other is around ability to participate as well. So women have consistently lower take-up rates of social insurance, and as was mentioned previously, this is partly due to their low representation in the formal workforce and high representation in the informal workforce. And although there is progress to recognizing that particular forms of informal work, such as the domestic workers in Brazil and South Africa, for example, there's been some recognition that these should be included into social security schemes. Really, largely, they still have very limited coverage. Informal workers, obviously, by definition, don't have contracts. They have no employer in most cases. And the scale of this, again, is huge. I mean, in South Asia, for example, employers represent less than 2% of the informal workforce. And another issue that informal workers face as well in terms of eligibility is that they are still largely invisible, largely unorganized, and lack limited bargaining power, although there are exceptions to this. The second point of the coverage gap is around participation. So even if informal workers are eligible to contribute to a social insurance scheme, sometimes the issues around participation are huge barriers. Some of this is due to quite obvious tangible factors, such as the capacity to contribute. You know, women are represented at the lowest hierarchy in terms of informal workforce. They earn less, they have less reliable income, they might be in and out of the informal workforce due to care responsibilities, domestic responsibilities, and so unable to contribute even small amounts to social insurance schemes. The other factor is sort of more intangible reasons. A lot of research has shown that women in particular are affected by, that they need a lot of high level of trust in program providers, and they need and the perception of benefit, so in terms of what they think they will gain from it, needs to be very clear in order for women in particular to make that investment in social insurance schemes. So moving on to the second point here around the low coverage of certain types of risks. Here we find, informal workers are vulnerable to a lot of risks, especially associated with their work. So in terms of their environment, their way they're working, in terms of hazardous situations, less inadequate sanitation or water, and the types of work that women and men do in the informal economy as well can bring significant risks. Women are highly represented in domestic work, in sexual work, as waste pickers, for example. Women also have an additional risk in terms of life cycle risks and reproductive health risks. I mean, pregnancy and childcare being the biggest one there. But insurance schemes rarely address these risks. Maternity protection, for example, continues to be extremely low. In terms of numbers, only 28% of member states comply with the ILO Maternity Protection Convention, and it's really a huge problem in terms of coverage. Also, insurance schemes might become more expensive to cover because of maternity or reproductive health issues, or they don't cover it at all. And here I think that it's really important what we've been talking about previously in terms of finding ways to, or finding mechanisms to cover these types of risks, which aren't necessarily by social insurance, but might be better covered by social assistance. In terms of the unequal benefits, even if both men and women are participating in a social insurance scheme, you might find that men disproportionately are favoured. And here a case in point is around the pensions and the way that pensions tend to be designed based on this sort of male breadwinner model, which is designed according to how many years you can contribute, the proportion of your earnings, for example, without taking into consideration, again, women's lower contributory capacity and being in and out of the labour force and perhaps having a smaller amount of time to contribute to such schemes. So finally, just in terms of the concluding points on the next slide, so what does all of this mean for a social protection system? What does this mean for extending coverage, for being gender responsive in developing social protection and social insurance systems? I think one of the first points to just think about is the appropriateness of social insurance as a mechanism to address the risks and needs of informal workers. And again, it might be that for certain risks, and I think this is especially true, for some certain risks, it might be that social assistance is more appropriate than social insurance, and social assistance might present a more viable option to ensure adequate benefits. And again, this comes back to the importance of social insurance and social assistance being part of a system that integrates these two components, as well as linking to broader services and programs and regulatory environments. In terms of program design and implementation, there are a number of features that could be improved access and benefits from social insurance schemes, particularly from a gender perspective. Just picking up on a couple of issues here in terms of flexible payment options, for example, which take into consideration the direct and indirect opportunity costs of participating in a scheme. Pooling risks rather than them being individualized might be more appropriate for covering certain types of risks like life cycle risks. And low fixed premiums, for example, might be better rather than a contribution of percentage of salary for women, given their different participation in the labour market. And my final point is around a transformative agenda. So there is a need to ensure that social insurance and social assistance provision meets an adequate standard of living for men and women. But I think we shouldn't also lose sight of the potential to harness a more transformative agenda through these social policy programs as well. And it just reminds me of UN Women, again, proposing how social protection and services are organized and delivered can incentivize changes in social norms and issues like persistent discrimination, such as men taking on childcare responsibilities, for example, the importance of empowering women through better labour market related policies. And I'll finish there. Thank you.
Thank you very much, Rebecca. And now we start our questions and answers session. And I would like to give the word to Daniel Horn, our partner at HelpAge, who is the co-organizer of this initiative. Daniel, over to you.
Yes, hello. I hope everyone can hear me. I'd just like to say thank you to Stephen and Rebecca for giving an excellent presentation. Being currently in Vietnam, discussing that issue, it's quite enlightening to see that. One of the things, and it's not really a question I have, but one of the things we've noticed, and it's more of a comment, is that I have to absolutely agree with Stephen that non-contributory schemes are critical in a world where informality and poverty is quite rampant. And one of the things I would mention is that contributory and non-contributory schemes are intended to work together. They're not intended to work in isolation. And I think this is one of the issues that needs to be discussed. And perhaps some of the audience would like to ask some questions regarding this. In the sense that social pensions, for instance, non-contributory universal social pensions, are not intended to be the bulk of income for families and for households. Most cases they are, but that's really a problem, and that's really a sign of systematic failure. If they operate correctly, if the system operates correctly, the individual schemes within that system carry the amount of burden they should be carrying. And that really turns to a larger issue, that universal social protection schemes, or sorry, systems and the schemes therein really need to be seen in terms of a larger umbrella of welfare system programs, which are family policy. Because many of these policies, and it seems rather odd to consider pensions as that, pension systems, they are family policies. And in countries like Sweden, they're very complementary policies which help working families adjust to the daily lives and the daily needs of what they need to get done. And lastly, my comment is on, in a lot of ways, we are having a debate that really needs to be had in other policy areas. And the one I'm thinking about currently is tax policy, because oftentimes we sort of focus on the benefit side and not realizing that in order to provide these benefits, we really need the resources, the fiscal space to do so. And that fiscal space is a lot of times, in most of the cases, comes from political space, the political will to design a system that has high compliance, that citizens trust to perform well, and that comes from a culture of professionalism and efficiency that only really accountable systems can really provide, and that you really need to have trust in the system to work in order for that system to do its job. And those are really my three basic comments, that schemes work within a system, of which social pensions, I believe, are a critical part, and it's absolutely necessary to have them in all contexts, and that they are possible. The second is that they're part of family policy, they're part of larger policy. And the third is that we need to focus on financing these benefits, these entitlements, and that requires a lot of times compliance with tax systems. But those tax systems need to be designed with the citizen in mind and not what governments wish would happen. Thank you very much.
Thank you, Daniel. Before we move to Stephen and Rebecca's reactions, I would just like to add a couple of questions that we received. So, I mean, one of the most touched upon points is how can very poor countries put in place universal social security systems? Another point is how do you evaluate the role or the potential role of microinsurance to contribute in the challenge of extending the coverage to informal workers? And finally, if you have any examples of best practice in the harmonization of contributory and non-contributory systems, or in extending the coverage to the informal workers that you would both like to share. So I guess we can start with Stephen and then move to Rebecca. So Stephen, over to you.
Okay, thanks for that, and thanks for Rebecca's discussion and for Daniel's comments. I think stressing the whole point of the system, I think what I didn't go into, and I think we probably need to recognize, is that often when we talk about social insurance and the extension of social insurance systems, much of the extension is actually tax financed. So many of the health insurance schemes, such as the one in Rwanda, the extension of it is not through an insurance mechanism or from contributions. It's government paying contributions on behalf of citizens, so they're actually financed from tax. And many social insurance schemes, we call them social insurance, but in fact they're financed by tax. The social insurance system in Vietnam, much of it is actually financed by tax. Most of the civil service contributions are financed from tax, and often these are, it's about transferring resources to the more powerful. Even in the UK's contributory pensions, you can get a 40% tax rebate, which is in fact, a tax handout to you if you make contributions into the contributory pension. So social insurance schemes tend to be often underpinned by tax financing, and it's very difficult, particularly in health insurance, to extend schemes out that do not have tax financing. So I'd agree with on Daniel's on points, and I think it's about a system, but critically it's about increasing tax and getting more into the system. But this comes back to the point of the social contract, I think, is that only by schemes for people, only by people receiving a scheme and being guaranteed to receive a scheme will they be more willing to pay tax, and you get into a virtual cycle. The problem that people have in many developing countries when schemes are targeted at the poor with using very arbitrary mechanisms such as like the proxy means test is that there's no right, there's no guarantee, there's nothing that you get as your entitlement. It's just whether you're lucky to get a scheme. That doesn't build a social contract. So you can go around and talk to people who are subjected to social assistance schemes with the proxy means test, and they'll say, hey, it was luck that I got it, or the computer decided, or it's just a lottery. That doesn't build a social contract, and it doesn't encourage people to pay taxes because they don't know whether they're going to get it. It's entirely arbitrary. Only by building entitlement schemes that everybody who needs it can access it when they require it will we build the social contract, and then will we build the confidence of people to start paying more taxes and to avoid taxes less. And it's going to be a 20, 30-year endeavor, but we need to make the step, and to make that step, governments need to step in to start financing entitlements much more, and they'll receive the benefits. And of course, there'll be many economic benefits from doing this as well. But we really should be looking at a minimum of tax finance schemes of at least 3% of GDP to cover, as Daniel says, a family system where we're covering children, people with disabilities, of working age, older people, widows, etc., all of whom may be in need of accessing social protection, complemented by social insurance schemes for those who can afford to go into it. On some of the particular questions, how can very poor countries have universal social security systems? I mean, I think it is only by, as I say, tax finance schemes. I think I've essentially answered that. If you want a universal pension system with universal coverage, you have to have significant investment through tax in that as the basic pillar on which you build your contributions, but you have to have universal coverage. But we've done simulations in a range of countries showing that you can provide the vast majority of children in many developing countries, everybody with severe disability and all older people, with reasonable benefits for up to 1% of GDP, which is not very much to do. We've done simulations like that in Vietnam, Bangladesh, and Indonesia, and a range of other countries. And this isn't very significant spending in that, and you could put in place an entitlement system for the most vulnerable people in a country. So it's possible to do, and it's possible to do in most countries, and to grow that over time, next 20, 30 years, to reach a more reasonable level of 3 to 4% perhaps of GDP. What's the role of microinsurance for informal workers? I think it's great to put in place microinsurance schemes, but they can never be the basis for any system. The basis has to be schemes provided by the state or overseen by the state, either social insurance schemes or tax finance schemes. Microinsurance is great to give you, you know, access to other types of risk that you can get covered. But often, you know, the microinsurance schemes that are put in place, say often for micro pensions, that's what they're talking about, are really just saving schemes, and people can access those funds whenever they require. So they're a great addition, but they're only a nice addition to the system. They're more like the voluntary schemes that you can access. It's great to put them in place, but they're not the answer to universal coverage. And what was the last question? It was harmonization of social protection and
so any examples of best practices that you think of concretely?
Yeah, I mean, I think I mentioned Chile's system previously, and I think the reforms they made in the late 2000s were interesting to look at by ensuring, at least in the pension system, some kind of universal coverage through a pension taper. So you begin to have that. But I think, you know, to be honest, a lot of the countries, and I showed a lot of developing countries with universal pension schemes or pension-tested schemes, are already actually offering some pretty good examples. Georgia's got a great pension. If you live in Georgia and you're old, you're getting a great pension. South Africa's moving towards a universal pension very soon. Brazil has an interesting mix of contributory pensions and tax finance pensions, but providing almost universal coverage. So we have a range of countries. Bolivia, for example, it's universal pension. Mongolia, I think, would be a very interesting example to look at. You have universal pension coverage to a large extent from social insurance schemes, but some tax finance pensions. You have disability pensions there, universal child benefits costing 1.4% of GDP, which ensures coverage for all children. Know enough about it, and there's not enough studies done on Mongolia, but it seems a really interesting country. Look, they managed to provide this coverage to these three particularly important groups of the population. I'll stop there.
Thank you, Stephen. Now, Rebecca, over to you.
Okay, great, thanks. Yeah, I'll just pick up on a few of the points. Again, I totally agree with Daniel about the systems approach and the importance of thinking about how each of these components within social protection should lock together, but also the broader issues around you know, family policies, but you know, social services and regulatory regulations as well, in terms of, you know, labour market, employment law, etc. I mean, and you know, these need to go together in a comprehensive and a systematic sort of way. You know, I think one of the issues which around financing. I mean, obviously, it's, you know, the important thing is about how you finance a system, which is, you know, is about financing, but is also about politics, as you mentioned. You know, and I think in quite a few countries we still see that particular social protection programs are pushed at the expense of thinking about a more holistic and integrated approach to a system, although I do think that that's also changing. But I think the long-term perspective to that is also really important, and thinking, you know, through what are the steps which need to be taken for this longer term perspective, and, you know, yes, covering the most vulnerable population, but not forgetting about the working age poor as well, and how to extend social assistance or social insurance, or, you know, the labour market policies to the working poor, and particularly, you know, thinking through the different gender dimensions as well. And I think drawing on that, and in terms of the question around how can very poor countries put in place universal social security systems, and I think, you know, just in addition to thinking about financing actual programs and policies, I think it's really important to remember how much investment needs to go into the implementation of these programs and policies. You know, you can have such a well-designed policy at national level, at program design, but the implementation of it is absolutely critical as to whether the benefits are received, as to whether the intended impacts and effects are actually achievable. In terms of the question around microinsurance, again, I also agree with just what Stephen said. You know, I think microinsurance does have a role to play, but the coverage is small, so I think it's always going to be just a smaller component of a bigger system. But there are some really interesting examples, for example, from Sewa in India, about how their insurance schemes have covered informal workers, and you know, they also they do reach quite a few thousand people, I guess the benefits of the microinsurance is that it can be designed at a very local level to respond to the types of risks and vulnerabilities which specific groups of people face, and I think that's a real benefit of microinsurance schemes. Just finally, on the best practices in contributory schemes or extending coverage, you know, I think there are a few ways that social insurance in particular can better address the needs of informal workers, or can extend coverage, and part of this is through legislation and the kind of categorization of workers. So as I mentioned in the discussion, that extending or adapting social insurance schemes related to work, so unemployment or maternity benefits, you know, they can be adapted to include informal workers, for example. Or, you know, the bigger issue there is about the move towards formalizing the workforce as well. And then issues around flexible payments and flexible contributions, or reducing the premiums. You know, I do think there's a big question around, you know, health insurance, around some of the other insurances, as to whether social health insurance is the best way to go for reaching the very poorest, or universal health systems are the best option. So I think there's, you know, those are important things to consider as well.
Thank you, Rebecca. So we won't have time to answer all the questions that came up today, but just for, we have a couple of minutes, so a final question would be, how can countries better overcome fragmented social protection delivery and move towards integrated social protection schemes, contributory and non-contributory, and how can it relate to a rights-based approach to social protection? So, Stephen, over to you.
Okay, that was fragmented schemes, was it?
So how can countries better overcome fragmented social protection delivery?
Yeah, I mean, we find a range of countries, you know, a lot of small schemes get delivered. Often in developing countries, it's development partners who are pushing their own little schemes. We find a multiplicity of schemes, you know, across. People aren't working together. The Paris Accords aren't working, as we find, and we find many schemes coming out from many different interests. What we need is governments to be in a position to be much stronger, to start consolidating the scheme and get behind the main risks and get behind a life cycle system of social protection, where we're addressing the main life cycle risks, similar to what we do in developed countries and certain developing countries, and build a life cycle, an inclusive life cycle system. That means at every stage of your life, when you require social protection, you're able to receive it, whether it's at childhood, whether it's working age or old age, but whichever gender you are, that you can access that. But it's only through an inclusive life cycle system that you'll be able to achieve it. And by making it inclusive and entitlement-based, and not using targeting mechanisms that are entirely arbitrary, such as the proxy means test, then you'll be able to have a rights-based system in place that provides very high coverage. So as I was saying before, on 1% of GDP, in certain countries where we're looking at 66% or 70% of children being covered, we can reach, in combination with old age pensions and disability benefits, 80–90% of the poorest just from those schemes at relatively low cost. And therefore, we have a cohesive system with 3 or 4 large programs around entitlements and rights that everybody can access when they need it. And as countries develop, then you can put in place this stress such as unemployment and kind of follow the evolution that actually we've seen in 100 years in developed countries. And we to look at that process. But it is about countries taking control, initially feeling more confident, standing up who will push their own particular interests with particular ministries and building and consolidating life cycle. Okay.
Thank you, Stephen. And Rebecca, for your final comments.
Yeah, thanks. So just very briefly, in terms of the fragmentation, I think it's really important to focus on not only governments and within a country in terms of fragmentation across government ministries, across implementing partners, etc., but also just looking particularly at the way that donors operate within a country as well, and across different social protection spheres and programs, and that coordination, in order to overcome this fragmentation, has to have many aspects to it, and that's including from the donor coordination as well as government and in-country coordination mechanisms as well.
Thank you, Rebecca. So thank you everyone who joined today, and thank you very much to Stephen, Rebecca, and Daniel. So don't forget to answer the survey that pops up at the end of the webinar so that we can improve the webinar series. And don't forget to join socialprotection.org and the Fiscal Space for Social Protection Knowledge Sharing Initiative online community. Thank you, everyone.